Hey mamas, you're listening to the Balanced Working Mama podcast, the only podcast teaching you how to balance your work, motherhood, and wellness. I am Dr. Amber Thornton, clinical psychologist and mama wellness consultant. Each week we dive into tips and strategies and much more so that you too can become a balanced working mama. Let's dive in. Hey mamas, we're here for another episode of the Balanced Working Mama podcast. So, let me try to balance everything that I want to say in this check-in. We're going to check in before we dive into our episode. Um, First, let me tell you, I am doing really well today. If you follow me on Instagram, you'll know that today I've been spending a chunk of my time. Today's Sunday. Y'all know I record on Sundays. I've been spending a chunk of my time really working on my ideas and plans and thoughts for building balanced working mama. I think what we've built so far is amazing. We've helped so many women. Actually, just the other day, I made a count of how many mamas have participated in workshops and empower wellness programs and wellness assessments. And since April of 2020, we have supported and closely worked with almost 40 women. And so that's amazing. And that was since April, 6 months. In 6 months, closely working with 40 mamas to really have more clarity about what wellness and motherhood looks like for them, to help them have more intention about how they want to make some changes and how they show up in motherhood and also balance their work and their wellness as well. And then really executing and making these changes and getting them done, sharing it with their family, letting their friends know, like really showing up so differently. And I'm so blessed and honored to be able to do this work. And again, I think what we have built so far is amazing, but y'all know how I am. We're not just going to stop here. We're going to keep going. And I really have a lot of visions and ideas for what 2021 is going to look like. So that means we have to plan now. And so I've been working a lot today with just putting some ideas and plans into motion, just really settling into that, because I think now Sundays are going to be my days to really do that type of work where I really get to focus and get creative and really think about expanding. Um, I also have to plan because I'm having a baby in 2021. And so that's another thing. And I think it's something that is new to me, but I'm learning. Women in business is up and coming, but it's not as abundant as we see men in business. But then also the challenges that women have in business are very unique in that some of us have babies, and a lot of us have a lot of the home and childcare responsibilities, and just sexism and oppression, just all these things that we have to deal with, and also still figure out how to run and maintain and build a business. And so I'm really thinking about that and thinking about, okay, well, what does April, May, and June look like for balanced working mama? So it's forcing me to get creative about what that means, whether that means hiring more people to show up for the mission and the cause of balanced working mama so that I'm not the only one anymore, or, whatever it is. You guys are definitely going to know once these ideas come to me. But I've just been in a really good place of planning today, and it feels good. Otherwise, I'm doing well. My son's doing well. Little itty bitty baby's doing well. Um, and husband's doing well too. Everything's good. Um, so I want to kind of set the tone of today's episode for you all, because the episode might be triggering for some. And, the thing about it is that we have to have these hard conversations. We have to have these difficult conversations because, as we know, motherhood is not just a walk in the park. Everything's not always great. There are some challenges, there are some struggles, there are some downsides and dark sides, and we're going to talk about a few of those today. Our episode focuses on challenges with trying to conceive, but then also pregnancy loss. And so I have a guest on that will be talking with me today about her experiences of trying to conceive for 3 years before she was able to have her baby, but then also the mental and emotional toll that the pregnancy took because there were a lot of complications. And then today in this episode, in our conversations, I will be sharing a little bit about my two experiences of pregnancy loss. So, I also want to let you all know when you hear me talking about pregnancy loss, these are losses that happened in the past. So, as of today, I am fine. The baby that I am carrying right now is fine. So, we are not talking about present day. I want to make that clear because I don't want anyone to get worried or upset thinking that something has happened to me recently. The losses that I'll be talking about happened in January of 2018 and then also in April of 2020. So just want to clear that up for anyone who might be getting confused. As of right now, all is well. But again, there are things that we experience, and I think it's so important to have these conversations, not just now, but all the time. I know we're doing it this month because October is the month to really talk about and share more about pregnancy loss, infancy loss. And actually, I do believe there's a separate month for trying to conceive and infertility, but we threw that in here for this episode. But again, I hope that this episode um, serves as some support and validation for any mama out there who has struggled with this or who is currently struggling with any of this. Know that you're not alone. Know that any feelings that you might be feeling are valid. You need to feel all the feelings because our guests and I share in this episode that we experienced a lot of hard feelings that were hard to talk about, but we talked about them in this episode. So I hope that you'll enjoy this episode. Hopefully, it'll help you know how to support yourself, but then also another mama too who might be going through this. So let's dive in. Hey mama, Balanced Working Mama is growing. I want to make sure that you stay connected and up to date with everything happening over here. So you don't miss any of the good stuff, head over to balancedworkingmama.com, sign up for the newsletter. You'll always be the first to learn of any new podcast episodes, events, programs, and you'll get a hello from me every now and then. So sign up today, mama, because I want to connect with you soon. All right, everyone. So we have another very special guest today. I'm very excited to talk with her today about her experience of becoming a mother and some challenges that she experienced with trying to conceive, difficulties in pregnancy, mental and emotional challenges. And so I am actually going to have her introduce herself. Shamika, will you please let us know a little bit more about yourself today?
Hi, everyone. So I'm Shamika. I am a mom of a 1-year-old little girl, little diva. I am also a board certified assistant behavior analyst, and I am a military spouse. So that's kind of the gist of who I am at the moment.
Awesome. So you are a lot of things. And so let me fill everybody in on how you and I connected. And it was very random. I was following you on Instagram, and it maybe was like a week or so ago, a few weeks ago, you had shared this beautiful video. It was like very beautifully like created and put together. And I think it was maybe like 2 minutes or so long, maybe a little bit longer. But I was fully invested in this video. And so I was watching, and it basically was your story of, excuse me, becoming pregnant and sharing that with your family and just the joy that you all experienced, but then also how all of this joy was coming after many years of challenge to get to this place. And so it just really warmed my heart and it just made me feel a bunch of feelings. I felt so many things. And so I think I reached out to you and I was just like, this was so beautiful. Thank you so much for sharing this. Like I'm sitting here crying. And then you opened up and you just kind of said, it just was a journey for you and how you've been wanting to share your story and feeling more ready. And then I was like, ooh, perfect opportunity. Come on to the podcast. So I'm so happy that you're going to be sharing your story with us today. As we know, October is Pregnancy Loss and Infant Awareness Month. And so you and I today will talk a little bit about several experiences, because I know that your story is going to be about challenges that you experienced with trying to conceive. And I've recently been a little bit more open with my audience about how I have experienced two miscarriages in my life. Um, one in January of 2018, and then also more recently in April of 2020. And so I just think it's so important this month, but then also ongoing, for more of us to have conversations like this, because I think there's this misconception that pregnancy or trying to become pregnant is easy, or it just happened and just be like, okay, go do this thing, and then boom, there you go. And that has definitely not been my experience, and I know that that has not been your experience. But then on the flip side of that, I get the sense that when we have experiences that are not easy and smooth, we are not allowed to talk about them, because people feel like, oh, that's just too much information, or you don't want to burden people with those feelings, or you don't want to disappoint people. Even just the idea of, oh, if you're pregnant, don't tell anyone until you get to this safe point.
Mhm.
It's just like, well, I'm having a whole range of experiences, and I need support. So I'm so glad that we're going to be talking about this stuff today, but I really just want to have you start with sharing your story with us, because again, your video was so touching for me, and we'll make sure that we share your Instagram info at the end so people can go see the video if they're curious. But could you please just share your story with us?
So, um, my husband and I, we always knew we wanted to have kids. We always said we wanted two kids. And so many people around me were getting pregnant by accident. So I was like, this is going to be a breeze. This is, you know, no different than anyone else. But that was not the case. So we were actively trying for 3 years. We changed our diet, started exercising more, both of us, just on the recommendations from my doctor. She was like, maybe you need to lose some weight, or just change the way you were eating. So we did all of that, and nothing really happened. We were tracking my ovulation, which became a job.
Mm-hmm.
Being intimate with my husband became a job. Um, and we didn't, it kind of became a burden. And we decided, we don't want to track it as heavily as we were tracking it. We were still aware when I was ovulating, but we wanted it to still be passionate and enjoyable. And then at one point, my period stopped coming for about almost 6 months. And I went to the doctor, and the doctor had a male physician at the time, and was not really pleased with how serious he was taking what I was coming to him and telling him about. I'm like, listen, I know my body.
Mm-hmm.
I also have a kidney disease, which led to a lot of my complications in my pregnancy. But I was like, I know my body. When something's not right, I know. No, if his exact words, if I did a fertility workup on every woman that came into my office after a few months saying her period didn't come, do you know how much money that would be? His
Excuse me?
exact words. I
Oh
called
my God.
I called our insurance, and I said I need to change my doctor. Got a female physician. As soon as I spoke to her, she was like, let's figure it out right away. Let's figure it out. So I was grateful for her. I had to
Mm-hmm.
be put on a progesterone medication for, I think it was about a month, and that kick started my period again.
Mm-hmm.
Um, Still didn't get pregnant, so now we're about 2 years in. Um, we kind of say, let's just give it a rest. Maybe it'll just happen when it's supposed to happen. So we rest for like maybe 6 months, and I'm like, no, like this is what we want. Like, let's go see someone. Went back to the doctor. It was a fight. Military insurance is a little tricky. Some people think it's the greatest thing, but we had to fight, and I got authorized to go see a fertility specialist. But we were in a very rural area. where my husband was stationed. So we had to see another fertility specialist. And he introduced us to the option of IUI, which is intra uterine insemination. So basically, it's
Mhm.
a way cheaper option
Mhm.
than IVF, basically.
Okay, because that's what I usually hear about. It's IVF. I don't think I've ever heard of IUI.
Yeah, IUI is much cheaper. I mean, it's still pricey, but we got
Mhm.
a quote of, I think it was like 1,500 per treatment if we did
Mhm.
it. And basically what it is they collect the sperm, they wash it, they basically treat it in a solution, and
Wow.
then they watch it for a while, and they take the best sperm out of the bunch, and then they insert it into the uterus. So that's pretty much the short procedure of what IUI is.
Wow. The amazingness of technology.
I know. I never heard of
Oh
it
my
because my
gosh.
mind automatically went to IVF. I'm like, we can't afford that.
Mhm.
Like, how are we going to afford that? But the specialist was like, no, there's another option we can try. So,
Wow.
but before our consultation
Mhm.
appointment, I found out I was pregnant. So it kind of worked out that way. And that's just a short summary of how emotional and draining the entire process was. And um, it wasn't easy. Like it's a short synopsis, but a lot of heartache, a lot of crying every time we had a negative pregnancy test.
Mhm. And like you said, that's the brief overview, but I just want to like pause on the fact, like you said, 3 years. 3 years is a long time. It is so long. And so it kind of leads me to my next question of I would love for you to kind of talk a little bit more about what was your mental and emotional like state and experiences throughout that time. And I'm sure it fluctuated because again, 3 years is so long. Like for me, I'm just imagining, like you said, like in at this age, we're watching people have babies and many of them it just happens so easily and you're wanting the same and I can only imagine all the feelings that you were feeling, but like explain that a little bit more. What the heck were you feeling?
a roller coaster of emotions, and it did fluctuate a lot.
Mhm.
I'll say some weeks
Mhm.
I was absolutely okay. I was like, you know what, I really depended on my faith a lot, even though it was tested,
Mhm.
and it wavered a lot. But some weeks I was like, you know what, this is what is supposed to happen. I need to just let go, focus on something else right now, and it will happen in its own time. And then other weeks I was just like, why me?
Mhm.
Like, why? I don't understand. There's no type of history of fertility issues in my family, in my husband's family, and I was like, why us? Why us? We were financially ready,
Mhm.
we were mentally ready. We felt like we traveled a lot and had fun. And okay, now it's
Mhm.
time. Um, so it was really an emotional roller coaster of just like, why us? What did I do wrong? Um, a lot of why me's. It was a pity party, but I just, people around me were still getting pregnant, and then I felt like it was almost a burden because people knew we were struggling. And
Mhm.
so like I even had a really close friend who didn't want to tell me that she was pregnant, even though I was super happy for her, but she was kind of like trying to be tender with me. I know Shamika's going through this. Um, and I had to tell her, no, like I'm extremely happy for you. That is in no way stopping me from wanting this for you too, you know.
Yeah.
But it was a roller coaster of emotions.
Yeah.
Oh my gosh, like not wanting to like get out of bed some days, especially after a negative pregnancy test.
Mhm.
Those hours and days right after,
Mhm.
those were the hardest. Those were the
Mhm.
hardest days. Yeah.
Mhm. Mhm. And again, like we don't hear these conversations enough, like at all.
I also couldn't speak to anyone because I didn't know anyone. I didn't know any support groups. We were also in a rural area.
Mhm.
Um, I felt like I couldn't. Of course, people are like, "Yeah, you can speak to us," but I was like, "How will you now identify with what I'm going through
Yeah.
because you haven't been through it?" And
Yeah.
so it's a very isolated place to be.
Yep.
Yeah.
Absolutely. I can only imagine. And so I know we kind of talked a little bit about before the episode started of like, I think you and I, our experiences are similar but very different in that for me, it's never been hard for me to conceive.
Mhm.
It's, I'm definitely one of those people where it's like, all right, try for a month or two and boom, there you go. But I've had the experience of having a miscarriage twice. And so some of the feelings that you are saying, it just kind of resonates with me because it's like, especially for like early pregnancy loss, there's, this idea of like, well, you can't really talk to people until you get to your second trimester. And so if you lose your pregnancy in the first trimester, not many people know. And so it's then you either have to break the news like, yeah, I was pregnant and I lost the child, or sometimes you have this feeling of like, I have more bad news. And I know I remember feeling like that, like, this happened to me twice. And, I think you probably maybe were a little better with me than me with, I know I experienced so much envy. Like there was a time, actually the last one in April,
Mhm.
I lost the baby at about 7 weeks. And at the same time, I knew like two other of our close friends that were pregnant. And my husband was like, oh, such and such is pregnant. I was like, good for her. And it was just like my initial reaction is just like, okay, whatever. I don't want to, I don't care. And he was just like, oh, really? And I'm like, yeah, like you don't know how this feels. I don't feel good about that. And I think even just being able to be real about, yeah, right now it's, for me, it was really hard to be happy for people that I otherwise would be so happy for, because I was just so hurt by what had happened to me. And so there's just so, oh my gosh, so many feelings.
I can't even imagine, cannot imagine, cannot, cannot. I can't even imagine.
And similar, like I'm thinking of your story, like I can't imagine, I know for me, and now looking back on it, it feels silly, but after like a month or two of trying, and I'm like frustrated, like, oh, it's not gonna happen. But then to hear your story and to realize like there are women who struggle with this for years. There are so many people who have this be an ongoing thing for so long, and it's just like I just cannot imagine.
It definitely, I know, I mean, obviously I can't speak for every woman who deals with infertility in some way, shape, or form, but it definitely lets you feel like you're less than a
Mm,
woman. And I hate that feeling because it's like, yes, it's something I personally wanted, but then I also thought about, well, is it society that's making me feel like this is what defines me
right.
as a woman? Childbirth, childbearing. And it comes with it along the entire spectrum of motherhood. It's like it goes into like, oh, is breastfeeding hard? Oh, if I can't breastfeed, nurse, that it's so many things on us as women.
Mhm.
Um, but yeah, it definitely made me feel less than for
Mhm.
sure.
Mhm. Definitely. I remember feeling some moments where I just felt like maybe something was wrong with me or my body, or just feeling like, okay, I must be doing something wrong. Or
Mhm.
I remember saying like little like slick comments about myself, saying things like, well, my body,
Oh yeah,
me,
oh yeah.
it's not gonna work for me. and
I can so relate. Yes.
and I would be saying these things to my husband. He's like, oh, here you go. And I'm like, well, you know how it is with me. It might not even work.
Oh yeah, I was like, this would happen to me, like, because I have my kidney gives me a hard time when it's ready. Like I call it a her, fight a lot, and I was like, it would be me. Like, I
Yeah.
mean, this would happen to me. Yeah.
Yep, absolutely. So relatable. And so it might be hard for this next question to pinpoint something, but I'm curious, like throughout your entire journey and your story, was there one particular moment or time that felt like the biggest challenge or the biggest hurdle for you?
Man, oh man. Uh, it's on top of struggling to get pregnant. Once I do get pregnant, I think I we found out early. You know, I was pretty much taking a pregnancy test almost monthly once we decided again to, track it. And almost right away after I found out, and it was really early. I think I found out when I was like 5 or 6 weeks pregnant. But I was deemed high risk right away off the bat. Um, and I kind of knew because I have a lot of specialists, and they're like, listen, some women who have your condition, they have no complications, and then you have other women and they have every complication in the world. And I fell into that category.
Mm-hmm.
Um, the biggest challenge for me was honestly every appointment was almost bad news.
Mm.
No exaggeration. No exaggeration. Either blood count was too low, or basically the baby was putting pressure on my kidney because my kidney disease makes my kidney fill with fluid, and so it swells. And so that is already causing pain, but the growing baby and all, the pushing of the organs is now putting extra pressure on that. And so it was just coping with, I can probably count on one hand, maybe like 3 times out of the numerous amount of doctor's appointments I had where the doctor was like, oh no, that's it. Everything's good. And I was like, what? So it was, the biggest challenge was coping with the bad news.
Yeah.
And just, I started to resent Avery before she was even here.
Oh my gosh.
And I don't think I've ever said this out loud, but when she would move, because it really, the prenatal depression really started to set in around week 20.
Yeah.
And I would be angry when I felt her move. I would feel disgusted. I would, such a place of, I don't even know what the word is, conflict almost, because I'm like, here is a child I prayed for, I wished for 3 years. But also, like, my doctors was like, this pregnancy could kill you. It could kill you. It could kill the baby. And I'm like, and I started to resent her. This little thing that I prayed for, that I hoped for so long. That was the biggest challenge. Is mentally I was unwell. And I couldn't believe it. I was like, this is not happening to me, because this was supposed to be perfect. We waited so long. This was supposed to be an easy ride. And it was not, by far not.
Yeah.
Preeclampsia, gestational diabetes, hypertension, just to name a few. Like, everything that could go wrong in a pregnancy pretty much went wrong in my pregnancy. That was the biggest challenge, is dealing with that and literally resenting my baby. Literally resent. My skin would crawl when I felt her move. Would crawl, and it's, oh my God, it sounds horrible, but that's exactly what I was dealing with at that time.
Yeah. And it does, to me, it does not sound horrible. It sounds real. And like, I'm almost getting chills because I'm just like, whoo, that is so honest, and it's so transparent. It's so authentic. And again, I just feel like so many moms that are listening are going to be so inspired by you, because you are keeping it real. Like, it
makes me feel like I'm a bad mom. And it did at the time too. And it once again, very alienated place to be in, because I'm like, I cannot now tell that we waited for a while. So that video, our family, loved ones, closest loved ones, didn't know I was pregnant until I was about 15 weeks or so. And like, I'm like, I cannot now turn around and tell my friends and my family that I'm feeling this way. Like, I'm going to hear, you're ungrateful. How could you? Felt very alone. Very alone. Yeah.
Yep. It just reminds me of, like, sometimes our family and our friends try to be helpful and supportive, and good intentions, okay, but we know that the impact is so much greater. And so they just don't always know what to say. Because I was just about to say, I'm sure that there was going to be people that were telling you, like, what do you mean? You've prayed for this. You need to be grateful that the baby's moving. What do you mean you don't like it? And all the while, in their minds, they're trying to help you be grateful, but that's not where you're at. Or like for instance, for mothers who have experienced pregnancy loss, a lot of times the message is, well, at least you can get pregnant. Or,
At least statements. Oh,
oh, I hate at least.
chills.
Oh my God. It's the worst.
Give me chills.
They just say these things like, or, well, it'll happen again, like completely negating what you're feeling. And so, our families and our friends, they really try, but again, this is why these conversations are so important, because I think people need to hear what our experiences are so that they can then know, okay, if I say that, that probably won't feel good, or this is a little bit more of what she's going through in this moment. Because absolutely, like what you experienced and what you just described is just so complex. It's like you said, yes, I've prayed for this baby, I've wanted this baby, and yet this pregnancy is putting my life at risk. And that is a lot to manage. It's a lot.
Yeah. Yep.
So that leads me to think of, the next question I wanted to ask you, and it's a two-parter, is about support. And so I'm imagining that there probably, hopefully, hopefully there were some things that felt supportive to you. And so my question is, what were the things that felt most supportive to you in this moment? But then also, what were some of the things that just were not supportive and not helpful to you at that moment?
In the moment, I really, honestly, my husband is a godsend because
Mhm.
I know I was a lot. I'm still, you know, but he was so patient, and I know like he was also scared because he knew that this was putting my life at risk, even more so than the baby's life.
Mhm.
And he was a huge support system, even he is active duty in the military, and he rarely missed an appointment, even when he had to kind of like argue his way out to make it. And he was right there, like holding my hand through every single appointment. Even when we got bad news, he's just like, okay, but look at the positives. And I'm like, shut up. Like, I'm not right there. I'm not there right now. But
Yes.
like, well, listen, one time he was like, she has 10 fingers and 10 toes. And I was like,
Oh.
okay.
Like, don't start.
But so he was a huge support. I call them my mom tribe. Um,
Mhm.
I think people are put into your lives for a reason.
Mhm.
And it's three of them, Kara, Ivy, and Emery, also military spouses, but they really like rallied around me. Um, one week when I was having a really bad week, I really shut down. I turned off my phone. I wasn't really speaking to my husband. I don't know who reached out to who, but one day I hear banging. We lived on base. I hear banging at our front door, and I'm like, I haven't been out of bed in probably like 2 days, other than like wash, barely eating.
Mhm.
Um, and he was like, I think you should go open the door. I'm like, no one's coming for me. I don't care. Don't want to speak to anybody. And it was one of my friends at the door. And like, I looked through the peephole and I was like, what? And she was like, open this door right now. And basically forced her way into my house.
Yeah.
Like in tears, I'm crying. She's crying. She's like, you're not going to do this.
Mm.
We are here for you. Tell us what you need.
Mhm.
And it meant the world to me because it's like they did not know what I was going through,
Mhm.
but still they didn't just accept that,
Yeah.
let me kind of sit in that emotion and that dread that I was feeling. So that was a huge support. Um and honestly, prayer and God, really,
Mhm.
just a
Mhm.
lot of prayer. Even when I didn't feel like it, sometimes I didn't know what to say, and I was just like, God, I'm drained. I don't know what to do or what to ask for specifically. Um, and then things that weren't helpful, um, me not seeking therapy,
Mhm.
because I come from a Caribbean background. It's very we don't do that. What happened? That's it. And we always grew up that way. But
Mhm.
I think honestly, I think if I would have sought therapy early on, it would have helped
Yeah.
tremendously.
Yeah.
tremendously, tremendously, because it's helping me so much now.
Hmm.
And I waited a long time. I didn't start actively going to therapy until my daughter was like 11 months old.
Oh wow, because I was going to ask when did you start? Because I'm just thinking back. I imagine therapy would have been super helpful while you were trying to conceive.
My goodness, I didn't know it would be beneficial. I was like, well,
Hmm.
what is therapy gonna do for me? How's
Hmm.
it gonna help me in the situation? Like, it's not gonna get me pregnant. That was my mind state. It's
Hmm.
that's not. I need to go to doctors. I need to go to specialists. Completely forgetting like my mental, you
Yeah.
know. So
Mm-mm-mm. Wow. Oh my gosh, just so much, so much. And I'm sure that there's so many lessons that you can speak to, but what would you say is the top lesson that you feel like you've learned as you've navigated this whole experience?
let me see, because I wrote down notes. Top lesson number one. Honestly, and it might run into like what I would say to, I like to call them moms to be,
Mm-hmm.
is that it's not our fault.
Mm, yeah.
Pregnancy loss is not our fault. Challenges with fertility, trying to conceive, it's not our fault. I'm still working on that even till this day. Um, it's We have to show ourselves some grace
Mm-hmm.
and take things in strides. I used to be all for everything happens for a reason. I don't really like the term, but
Yeah.
I think we just have to be kind to ourselves
Mm-hmm.
and definitely realize it's not our fault.
Yeah.
None of this that we're experiencing is our fault.
Mm-mm. Mm-mm.
Find the silver lining in it in some way, shape, or form, and kind of thrive while we're going through it.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, that resonates a lot with me because I think one thing that I've learned in my experiences is that similar to what you said, there's just so much out of our control with these things, with like pregnancy and trying to get pregnant and then navigating the pregnancy and complications. It's just so much that is completely out of our control. And I've had to become more comfortable with that. And like you said, not necessarily the everything happens for a reason, but more so being able to let go of the things that I have no control over. I have no control over what my body is going to decide to do or, what my baby is going to decide to do while within my body. I do what I can to ensure that I'm healthy and baby's healthy, but otherwise, there's just a lot that is out of our control. And so that definitely resonates a lot. And I think that the other thing I was going to say when you said finding your silver lining, one thing I was just randomly thinking about this the other day. And actually, it's because I've recently been thinking about like Chrissy Teigen and just I think in October in general. I think I'm now seeing and hearing a lot of stories on Instagram and social media of just the countless and endless struggles people have with trying to conceive and pregnancy loss and just the whole experience of trying to make babies is just woo. And so the thing that I've has been hitting me is that I think people in our lives want us to feel better, right? Because it's really hard to sit with negative emotions. And so they try to spoon feed us the gratitude. They're like, well, here's the silver lining. This is how you should think about it. This is how I see it. And so they want you to feel better. But the thing that I've realized is like, there's nothing wrong with gratitude and there's nothing wrong with the silver linings, but it's something that you have to come to on your own with things like this. It's like, I can't have a bad experience and then you tell me what the silver lining is because I'm not there yet. I have to come to that on my own. And so, like, for instance, in therapy, I'm sure that this is what I would do in therapy. I would really try to help my client come to a place where they can see it from a different perspective, but it cannot come from anyone else. It really has to come from us. And I think that's the part that people miss is like, on the outside looking in, you can so clearly see, well, if they just look at it like this, then you'll feel better. But that really has to come from you when you're ready for it and when you're able to see it that way. And it's tough, but that's the truth. We have to come to our own places of gratitude and our own other perspectives of how to look at something, or our own silver linings. No one else can do that for us but us.
Completely agree. I completely agree.
Yeah.
It cannot be rushed. I completely agree.
Mm-mm. It cannot be rushed.
I
And it can take.
also think we have to allow ourselves to feel the feels. Like it's okay. I need to feel grief. I need to feel anger. I need to but I also having those resources and tools
Mhm.
to experience those emotions in a healthy way is also important. But it's okay to be there and experience it because we're human.
Absolutely. Absolutely. So I know we're coming to a close soon, but I realize we haven't even asked you yet. How's it feel now? How's motherhood? How's it going?
I still struggle. I am still dealing with some postpartum depression and anxiety,
Mhm.
um, which is a whole other conversation. um, um, but therapy is helping a lot, uh, tremendously. I had a hard time bonding with my daughter initially, um, and now I'm actively doing so, and that's helpful.
Nice.
It's still a struggle, a lot of negative self statements that I'm working through.
Yep.
Um, Still a lot of guilt, but I think that comes from generational things
Mhm. Mm.
that I'm trying to break
Mhm.
cycle of. But it's much better. I tell people that the first maybe 5 months of my daughter's life, if it wasn't for pictures and videos, I wouldn't know it happened. And
Mhm.
it's a sad thing to say. Sometimes my husband will show me videos and I do not remember. I was in such a cloud, such a fog. And it hurts me. It's sad. But I try to be super present with her,
Mhm.
but also very aware when I need time, when I need a break. And it's also very hard to speak about because I also feel like it puts me into, oh, you're a bad mom. Um, but I'm working through it, and I'm hoping that I can be more courageous, um, because I feel like a lot of women are going through it, but no one speaks about it, um,
Mhm.
because the fear of being told you're a bad mom or people thinking.
Mhm.
But it's hard. The journey has not been easy from beginning up till now. I'm still a work in progress.
Yeah.
Yeah.
Yeah. Well, I just commend you again for being so open and sharing your story. And I know that, I feel inspired by you. And I know that there's going to be others who are listening who feel equally inspired because, I just think we need to have more of these conversations. And, also what you just said, it made me realize too that, after having challenges with becoming pregnant, things don't just automatically become great once you have the baby. Yes, it's what you've wanted and what you've longed for, but there's still all this stuff to muddle through and to go through. Like you said, attaching and bonding to baby was hard because of some of that initial stuff that was going on. There's still complications with postpartum depression, and there's still stuff to do and to work out. And so I just love that you are open and honest about that, just being real. Like, look, just because I struggle to have a baby doesn't mean that now everything's great because I have her. There's
Hmm.
still work to do.
Yeah.
Yeah. Well, I just commend you, and you're not a bad mom. You're not a bad mom. You're so brave, you're so courageous. You are showing up every day, and I'm just so glad that we were able to have this conversation. So I thank you so much for it. I do have one last question for you. For anyone who's listening today, and if there are parts of your story that resonated with them, or if they are struggling with trying to conceive, or some of the other things that we have talked about today, what advice would you share with them?
Um, Before I get to that, I just want to thank you. As I said, I think people enter our lives for a specific reason, even though we don't know what that reason is a lot of times. So thank you for even asking me to come on,
Mhm.
and to share. And
Mhm.
I think your bravery kind of lends hand to my bravery, and then hopefully more women will be brave to speak about their experiences.
Absolutely.
Advice. Honestly, I would say one, it's not your fault.
Mhm.
Two, please practice self care,
Yes.
from dieting to exercising to, making sure you're hydrated. Um, if you meditate, if you pray, um, take care of your whole self. I think that's so important. Um, Build and lean on your village. I think having a support system is amazing and it's helpful. And the last thing is be your biggest advocate
Mm-hmm.
when it comes to your mental health, when it comes to your spiritual well being, and especially when it comes to your medical care.
Yes.
If you feel like something is off, something is not working, a treatment is not working, you know your body best. Advocate for yourself as hard as it, or it, not hard, but as intimidating as it might be sometimes. Please advocate for yourself.
Absolutely.
No, those would be that's what I've learned and I'm continuing to learn. But love on yourself a little. You
Mhm.
know, I think that's what the umbrella. Love on yourself.
Absolutely. That is such great advice to end on. And so, if any of the mamas want to connect with you, how can they reach out?
Well, right now I'm just at Instagram, Mika underscore Raquel. That's Mika underscore RACQUEL. Um, and then hopefully, I'm trying to kind of take my experiences and kind of branch out and help other moms in some way. So I'm kind of working on some things, but that's how they can find me.
Yes. Awesome. Well, I hope that there are some mamas that will connect with you. And please, please share when you do work on your things and when it's all good and ready, share that with me so that I can go back and share some of that. So, again, Shamika, thank you so much. This was a really great conversation, and I really loved talking with you today.
So much. Likewise, likewise. You're amazing.
Hey, Mama, I'm so glad you're listening to the podcast, but I also want to connect with you on social media. So be sure to follow me and Balance Working Mama on Instagram. You can find me at Dr. Amber Thornton. That's DrAmberThornton, and Balance Working Mama at Balance Working Mama. BALANCEDWORKINGMAMA. Follow along, join in on the fun, but then also send me a DM to say hello. See you there. Hey, Mama. I hope that you enjoyed that episode with Shamika. I'm just so happy that I was able to connect with her and we were able to have that conversation because, like we talked about in the episode, these conversations are not had nearly enough. And my hope is that we'll continue to talk about these things like trying to conceive, pregnancy loss, infancy loss, postpartum depression, prenatal depression, postpartum anxiety, prenatal anxiety. We don't have enough conversations about the painful experiences that we have as we try to become mothers. I know that this episode was really helpful for me. It was helpful for me to hear Shamika's story because her experience is not one that I've had. Likewise, it was so helpful for me to be able to just openly talk about some of the experiences that I've had with pregnancy loss because, again, I don't get to talk about it enough. And I think it's something that I want to talk about more because I know that I'm not alone. Shamika's not alone. And so I hope that this episode touched you. It resonated with you, whether it's something that you are experiencing, you have experienced, or whether you know someone who might be experiencing some of these things. I hope that you were able to walk away from this episode today and really think of how you might be able to support that person a little bit differently and or support yourself. So the homework for this episode, our Balanced Working Mama homework for this week is, for those of you who are experiencing challenges in your journey to become a mother, whether it's with trying to conceive or experiencing pregnancy loss, I really want you to take a moment and to challenge yourself to feel every single thing that you feel. Too often we push aside our feelings because we feel like they're too big, or we feel like they're not appropriate, or they make other people feel uncomfortable. But in those moments when you are struggling and challenging with something, when you're struggling and feeling challenged with something like this, you absolutely need to feel all that you feel. Even if it's envy, even if it's rage, even if it's jealousy, even if it's resentment, whatever it is, you need to feel it. I want you to challenge yourself to feel all the things, but then also consider, what is it that you need right now? I think another thing that happens is, when we're going through these experiences, we're afraid to speak about what we need because, again, we're afraid that it's too much, or we don't want to burden people with some of the challenges that we're going through, or we're feeling like, well, it's too much information to share this. And that's not true. What do you need? Lastly, have you been treating yourself badly, or shaming yourself, or just not treating yourself well as a result of the pain that you're feeling? For instance, Shamika and I both talked about our experience of really just saying negative things about our bodies after we felt like our bodies had failed us, or that we weren't getting the results that we wanted. And that's not okay. And so, how are you treating yourself during the experiences of pain that you're having? I want you to think about all that. But another question too is, do you need therapy? And if you need therapy, girl, go get it. There's nothing wrong with needing therapy in these moments. It's absolutely imperative that we get the help that we need. So consider therapy options that might be useful for you. But in short, I want you to really give yourself a moment to feel what you feel, to not be ashamed of it, to let people know what you need, but also to figure out, how can I treat myself better? Because I know that when I'm in pain, sometimes I might say things that are hurtful about myself or about my body. What is it that I need? And whatever it is that you need, I want you to find a way to get it. So, Mama, I hope this episode was helpful to you. Thank you so much for having the courage to listen to this and engaging in the hard conversations with us. It means the world to me. And I look forward to talking with you all in the next episode. Hey, Mama. Thank you for listening to the Balanced Working Mama podcast. If you love this podcast, please be sure to rate it and share it with another mama that you know. And don't forget to follow me and Balanced Working Mama on Instagram. I'll talk to you soon.